Coronavirus disease 2019. In this video, we will have detailed discussion about coronavirus disease. In December 2019, there was a sudden emerge of a lot of pneumonia cases in the city of Wuhan, China. Some of the early cases had reported visiting or working in live animal markets in Wuhan. Investigations found that the disease was caused by newly discovered coronavirus. At start, this virus was named 2019 novel coronavirus, which is represented as. After that, on 11th of Feb 2020, ICTV named this virus Severe Acute Respiratory Syndrome Coronavirus 2. And then on the same date, WHO named the disease Coronavirus Disease 2019. Covid-19 spread within the China and to the rest of the world. On 30th January 2020, WHO declared the outbreak a pandemic. Further, we will take a look of what is currently known about the Covid-19. Keep in mind this is a new disease, and what is known is rapidly evolving and might change in future. So, what is coronavirus? Coronavirus is a large group of viruses. Since December 2019, it has caused many deaths. The virus consists of a core of genetic material, nucleocapsid protein and RNA, which is surrounded by a lipid envelope with protein spikes on it. This gives the appearance of a crown. Crown in Latin is known as corona. And that's how this virus get their name. There are different types of coronavirus which can cause illness in animals and humans. Coronavirus can cause respiratory infection, ranging from the common cold to more severe disease. These viruses include Severe Acute Respiratory Syndrome Coronavirus, first identified in China in 2003. The Middle East Respiratory Syndrome Coronavirus, that was identified in Saudi Arabia in 2012. And then Severe Acute Respiratory Syndrome Coronavirus 2, first reported in Wuhan, China in 2019. Now, what is the origin of the virus? It is known that the coronavirus circulates in group of animals. Sometimes this virus can transfer from animals to humans. This is called spillover. This could be due to a range of factors like mutations in the virus or increase in contact between humans and animals. For example, Middle East Respiratory Syndrome Coronavirus is transmitted from animals into the humans, and Severe Acute Respiratory Syndrome Coronavirus is transmitted by wild cats. Now we will see how the disease spread. Disease can spread from one person to the other through droplets. These droplets are released from the infected person through talking, coughing, or sneezing. It can also spread when infected person droplets land on any object and then this object is touched by any other person. And then this person touches his face, eyes, or nose or eats anything. What symptoms can appear? Incubation period, which is the time taken by the virus for exposure and development of symptoms, take 5 to 14 days. There are a range of symptoms from very mild to severe, and some people may not develop symptoms at all. Some common symptoms include fever, fatigue, respiratory symptoms like cough, sore throat, shortness of breath. Some people may report loss of smell and taste, and some may develop skin rash. In more severe cases, there may be pneumonia, organ failure, septic shock, or even death. About 80% of people recover from the disease without needing special treatment, but there are some people who are at risk of serious illness. These include older people or people with underlying medical problems like high blood pressure, chronic respiratory disease, diabetes, obesity, cancer, or heart disease. Now, how disease is confirmed or diagnosed? The infection is diagnosed by a common test called reverse transcriptase polymerase chain reaction, commonly known as PCR. This test identifies the virus based on its genetic material. There is also a blood test which detects antibodies against the virus, which shows person was infected from the virus in the past. Now, what is the treatment for COVID-19? The treatment for COVID-19 is mainly supportive care. Currently, there are two vaccines that have been authorized and recommended for COVID-19: the Pfizer BioNTech vaccine and Moderna COVID vaccine. These are being used for treatment and prevention of COVID-19. As we know, prevention is better than cure, so there are several effective ways to prevent the spread of disease. These include covering your mouth and nose while sneezing with flexed elbow or with tissue paper. Wash hands regularly, maintaining at least 1 meter distance, and appropriate use of masks and personal protective equipments. I hope you like my video. Please like and subscribe to my channel.